All right, it's Dr.Sammy G in the house. I hope you guys have a great day. It's been a while. To all my 145 subscribers, I appreciate the loyalty. I appreciate that you guys are still there. You guys have been waiting for some new videos, for some new content. And if you guys wonder where I've been, I've actually been very busy. I've been working hard. I'm actually doing my residency in family medicine right now. So, things change, man. Time goes by, you get a different understanding of life, different perspective. You start to think about different paths. And now I just think that family medicine is the right direction. So to all the guys out there and all the ladies who've been following me so far, I appreciate the loyalty. It's been a while, like 2-3 years back, but I'm back. I am back. And I'll be uploading constantly right now about some different stuff when it comes to family medicine. Because you know what, guys? I need to study. I got to repeat my medical knowledge because at the end of the day, if I want to be a good family doctor, I have to study. So I just thought to myself, why not study and at the same time share that info, share that knowledge to the community, to the Dr.Sammy G community. So I'm back. So today's topic, most of you guys got some shoulder pain. There's no doubt about that. We all have some shoulder pain in today's society. And I think most of you guys share the same problem. You have the same type of pain, same type of symptoms, and I can guarantee you got the same type of diagnosis. What you guys have is something called shoulder impingement. Now, what is shoulder impingement? What makes you guys have some pain in your shoulder? And usually the same localization, which is pretty much here. Now, the shoulder impingement is pretty much an inflammation in a room or a region called the subacromial room. Now that subacromial room, ladies and gentlemen, is located between the acromion and the head of the humerus. Just look at the picture here. You see the picture? At the rooftop, you have the acromion, and at the bottom, you have the head of the humerus. Between that, you have the room called subacromial room. And it consists of the bursa, which pretty much protects your joint in a way that the tendon and the joint do not really collide with each other. And you have a specific muscle in a tendon called supraspinatus, the supraspinatus tendon, which is involved in stabilizing the shoulder joint. Aside from that, you have a tendon belonging to the biceps muscle. Now, what's going on? Why do you have the inflammation in that room, in that region, in that area? What's going on? Well, here's the thing. It's usually due to some type of repetitive movement causing a microtrauma in the tendon of the muscle called supraspinatus muscle. It's usually that tendon of the muscle that is inflamed. Now that muscle and that tendon is involved in moving the shoulder joint like this, abduction. So any type of movement where you're abducting the shoulder joint like this is gonna cause, as time goes by, an inflammation in that region. So here's the thing. Whenever you do any type of exercise, any movement that is pretty much stimulating the front shoulder, you're going to cause an inflammation in that area. So for example, if you're a meathead bodybuilder junkie who only do bench press 24/7, or you only go to the gym, you do some bench press, you do some biceps, you're only stimulating the anterior shoulder, that will result in some type of inflammation time goes by. That's the first thing. Second of all, maybe you're a boxer, you do a lot of jab, you do a lot of cross, you do a lot of hook, uppercut. You are also stimulating their anterior shoulder joint, causing also an inflammation in the what? In the subacromial room. So that's one example. Another example is if you are doing some tennis, front side, whatever you want to call that, front side or back side, or any type of movement or any type of activity that is stimulating the front shoulder is going to cause an inflammation in that area. And some people don't even do any type of physical activities causing the type of injuries. Nevertheless, they still have the same problem. That could be the fact that most of these people work at a desk. They're a bit front tilted with their shoulder like this, if you look at me like now. Or you might be doing some work. For example, you're working as a painter, painting the walls. You're a builder, like the Bob the Builder. Anything that pretty much stimulates the front shoulder. And most of the people in today's society, they are pretty much living a lifestyle where their anterior shoulder are more stimulated than their posterior shoulder, causing a asymmetrical distribution of the anatomy, and hence you will have an inflammation in the shoulder joint, especially in that region called the subacromial space. So that's pretty much the main reason why most people have shoulder problems. A society where our lifestyle and our pretty much our natural functions is actually colliding with how we live in today's society. That's it. That's pretty much it. So, now you might wonder, what are the symptoms that you can conclude that you have a shoulder impingement, or increasing the probability that you have shoulder impingement? First of all, any type of movement where you're working or doing a movement above shoulder height like this or like this will cause pain. And even if you sleep on that side, if you sleep on the right side, you have pain on the right shoulder and you sleep on that side, it will also result in some type of inflammation and pain on that shoulder joint. Other symptoms is pretty much if you do these type of activities that are stimulating the anterior shoulder. So if you're doing bench press, you may be a boxer doing a jab, you're doing a cross, you're doing a front hand or backhand in tennis. All these things will actually stimulate some pain in that area as well, which is pretty much here. This is the area where people have the pain when it comes to pain in their shoulder. That's usually what people have with shoulder pain and shoulder impingement. Yeah. So that is pretty much the symptoms. You got pain in your shoulders when doing activities that are stimulating the anterior shoulder, and even when you sleep on that side where you have the pain will also cause some problems when it comes to the shoulder impingement, and also increase the pain as well. So that's it. That's the typical symptoms. Pain, 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 pain. That's what it's all about. Now, the reason you have the pain is you have an inflammation in the area, and when you have an inflammation, it causes swollenness. And since that area is very small and it's become swollen, it means that the mobility is actually hindered. You can't do the same type of movements because it's so swollen. So the muscle that is responsible for abducting, it can't fully function because of the inflammation. And that's why it's so limited when it comes to your movement. You can probably go like this. And as soon as you go like this, you will feel the pain because of the swollenness and inflammation. So it's pretty much hindered. You can't do anything more. And even when you sleep on the right side or the left side, depending on where you have the inflammation, you're pretty much causing even more compact area, because when you sleep in that area and you put your head on the shoulder like this, it becomes more compressed. And as you get more compressed, that means that the shoulder joint and the subacromial space that you have the inflammation becomes more reduced, which also means that the mobility will be less and even the range of motion will be less. So that's it. That is the typical symptoms that you can have when you have shoulder impingement. Yeah. Now you may wonder what am I gonna do? Dr. Sammy G, what am I gonna do right now? I need some help, motherfucker. Sorry, I'm so sorry. I'm not supposed to swear. I'm a good guy. I don't swear. Sorry, I'm so sorry. I'm not supposed to swear. Sometimes, I'm from the hood, so my hood tendencies sometimes come back, and I'm trying to eliminate that behavior. So that's why I'm not supposed to swear. I'm so sorry. But now you might wonder, Dr. Sammy G, what am I gonna do? And Dr. Sammy G got the answer. He got the answers to your problems. I'm gonna tell you exactly what you can do. Now, it's actually like a staged program of treatments that we follow when it comes to shoulder impingement. Number one, it's rehab. Rehabilitation is the most optimal form of treatment when it comes to shoulder impingement, because at the end of the day, you need to strengthen your muscles around the shoulder joint. You need to strengthen the other areas around the shoulder in order for your mobility to increase and also to increase the range of motion. See, most of you guys are just stimulating the anterior shoulder. For example, you're a bodybuilder, you only do bench press. You only do biceps. That means you're only stimulating the anterior shoulder. If you're a boxer, it's the same thing. You're doing volleyball or basketball or even tennis, it's the same thing. And even if you don't do any type of physical activities, but you're just working at a desk like this, like I do right now, as you can see in front of a camera, 24/7, working in front of a computer, that will also result in a asymmetrical distribution of the anatomical muscles in your body. So you gotta do some workouts, which is pretty much going against your lifestyle. You gotta do the opposite. So if you live a lifestyle where you're pretty much stimulating your anterior shoulder more than your posterior shoulder, that means you gotta do some exercises that are stimulating your posterior shoulders more, so that you get a more symmetrical anatomy of the shoulder and hence reducing the inflammation. That is the first thing. Second of all, you gotta stop doing these type of movements for a while. I would say maybe 6 to 8 weeks. 6 to 8 weeks, take a break from these type of movements. And maybe you gotta stop doing some, exercises such as bench press or, bicep curls. Or if you're working as a painter, for example, any type of work that you're doing that you're actually stimulating the anterior shoulder, it can also means that you need some break from the work. So, go to a doctor and maybe you can demand some type of a certificate that you can't go to work because of your shoulder. So that's one example when it comes to treatment of shoulder impingement. Rehab is the best way. In the future, I'm going to do a rehab video for different type of shoulder exercises, different type of rehab shoulder exercises, so that you can optimize your anterior shoulder and your posterior shoulder, and also reduce the inflammation for those who have shoulder impingement. I can't do everything in the same video. I think you guys are getting bored. I know I'm an entertaining guy. You like to watch me. There's no doubt about that. However, you're not going to be able to watch the whole video. And I need the views. I need the views, yo. I need the views. So keep liking, keep subscribing. Back up Dr. Sammy G. All right? You got to back me up, bro. There's no doubt about that. Now, that's the first thing, yeah? Second of all, ladies and gentlemen, it is something called a cortisone injection. I'm so good at this. So if you need any type of cortisone injections, you can just contact me and I will help you. I will help you. I will give you that injection. But hey, I take cash. I don't take card. So how do you do this? Well, here's the thing. If you do rehab and it doesn't help you, you need to move on with the cortisone injections. So what you do pretty much is that a doctor, usually a family doctor like me, you come to me, you come to the primary healthcare, and I pretty much, with my assessments, with my medical assessments, I conclude they have shoulder impingement and rehab doesn't work. We move on with the cortisone injections. So what you do is that I put the needle in the subacromial space where you have the inflammation and inject the dipomedrol, which is pretty much cortisone, with the purpose of reducing inflammation. Now, if you combine that with rehab, I think you will have optimized results and your mobility and the pain will reduce as time goes by. Now, you should not get a lot of cortisone injections around the shoulder joint, because as time goes by and you have taken multiple injections of cortisones in the shoulder joint, it could actually degenerate the tendon, which can, as time goes by, result in a complete lack of mobility and a complete lack of movement when it comes to the shoulder joint. So it's not really optimal for someone to take repetitive cortisone injections in the shoulder joint. Absolutely not. It's not beneficial. It's actually more damaging and more degenerating than an advantage. So that's stage 2, yeah? Stage 2, cortisone injections with combination of rehab. Now, if this doesn't work, it's surgery. It's surgery. Now, I can't do the surgery, unfortunately. I'm not an orthopedic surgeon. What I would do is, if you go to your cortisone injection and you've been trying with rehab and it doesn't work, stage 3 is surgery. I write a so-called a referral letter to the orthopedic surgeon so that they can take the decision if they want to do the surgery or not. Usually they do like an ultrasound of the shoulder joint and also an MRI as well, just to conclude that you have an impingement or an inflammation around the area before they decide to do any type of surgery. But what they do is a surgical procedure called subacromial decompression. And what that means is that they have a camera. I'm going to show you a picture so you can understand what I'm talking about. Picture in a little video. But they have a camera. They put the camera in the shoulder joint. Bam! All right? Bam! In the shoulder joint. To have a better picture of how the shoulder joint looks, and especially in the subacromial space where you have the inflammation. And then they take another type of equipment called a shaver. The shaver comes into the shoulder joint as well. And what they do with that shaver is pretty much cleaning all the inflammatory tissue. They remove the bursa, or pretty much the bursitis, the inflammatory bursa and all the inflammatory tissue in the area. Furthermore, what they do is they pretty much remove a little bit of the acromion. So, like I said before, acromion is the roof of the subacromial space. So what they do is they remove a little bit of the acromion with the purpose of increasing the space of that region so that you can have an increased mobility and a better movement. And that is the last step, and the result usually gets better after the surgery. But like I said before, you still gotta do your rehab exercises. You still gotta do your mobility exercises, which I will show you guys in a future video so that you don't get the same problems in the future. Rehab and stretching and mobility, the purpose of these type of things is to prevent yourself from getting these type of problems in the future, all right? So that's pretty much it. That's shoulder impingement. And I think you guys know now what you should do. So if you think that you're dealing with shoulder impingement, I think most of you guys do, contact a doctor or consult with a doctor. You can you can even DM me. DM as well in Dr.SammyG on my Instagram page if you want to. DM me or even comment here on YouTube. And I can, with my assessment, with what I can do and I can think out of my knowledge and what you describe on the comment, I will try to help you and tell you what to do. All right. Now, we're finished with the video. Don't forget to like and subscribe. Help Dr.SammyG to grow. And guys, you take care of yourself. And I'll see you guys in the next video. Peace out.